Vaccination Building Global Capacity Learning session focused on regulatory and procurement aspects for COVID-19 vaccines. Next slide. My name is Bruce Strumminger with Project ECHO at the University of New Mexico, and it's my pleasure to be supporting the WHO ACT Accelerator learning series and have just a few housekeeping items to go over. Most important up front is that we have interpretation in French and Spanish. If you click on the globe icon at the bottom right of your Zoom toolbar and then select either French or Spanish, you'll have interpretation there. Next slide. We really look forward to your questions, so please put those in the Q&A feature, which is also along the bottom of the Zoom toolbar, and we'll be monitoring that and hope to get to as many as we can. Also, if you have any IT or logistic issues, please put those in the chat, and we'll also be putting a link to the certificate of attendance about 15 minutes before the end of the session. And next slide. We are recording today's session, and your attendance is consent to be recorded. There will be recordings in English, French, and Spanish, and we'll be making those available on the website dedicated to this learning initiative. And we'll put a link in the chat to that for everyone. For the certificate of attendance, that'll be offered through the University of New Mexico, also through a link in the chat near the end of the session. There's a brief survey, 2 to 3 minutes. We really appreciate your feedback. It helps guide us in planning these sessions. Next slide. Just a note about data use. The data you share with us when you register in the Q&A, et cetera, is stewarded very carefully. We take data stewardship seriously, and all your data is kept confidential. And what we share with WHO is all de-identified. Next slide. Just a reminder that this learning series is built off 2 open WHO trainings. One focused on national deployment and vaccination planning. That's part of this series that's every other week. And the other, which is focused on training for health workers. Those are online learning series, and we'll share these links to those in the chat as well. With that, it's my pleasure to hand it over to Shoshana Golden with WHO. Shoshana.
Thank you so much, Bruce. Hi, everyone, and welcome to this session. Next slide, please. I'll be sharing some announcements, today's agenda, and our learning objectives for our call today. Next slide, please. So a couple of really exciting announcements. The first is that we've now launched a new open WHO COVID-19 vaccine course, and it's about the vaccine-specific resources. This course will help you to understand how to handle, prepare, and administer the COVID-19 vaccines that have received emergency use listing or pre-qualification, which we'll hear a lot more about later today. Additional resources will be uploaded to this course as they become available. The course is currently in English, but will be translated to all UN languages and Portuguese. So that's Arabic, Chinese, French, Spanish, Russian, and Portuguese, in addition to other languages that are requested. Speaking of translations, our health worker COVID-19 vaccination course has now been translated into numerous languages and is currently available in English, Arabic, Chinese, Dutch, Indonesian, Macedonian, Russian, Spanish, and Vietnamese. We will have our French and Portuguese versions of this course launching shortly. They are anticipated for this week. We also have a number of job aids that may be useful for health workers and others handling COVID-19 vaccines. The first is an immunization checklist that helps health workers and their supervisors to plan for and conduct COVID-19 vaccination sessions. The second is a communications diagram that guides health workers in the appropriate steps, types of questions, and responses for how to handle different types of scenarios for COVID-19 vaccine acceptance, hesitancy, or uncertainty. All of these resources are available on the COVID-19 vaccine toolbox. I'll turn to the next slide, please. Many of you may have joined our last Tuesday session focused on infection prevention and control. As there was some need for clarification on key aspects of needles and syringes, we've provided those clarifications both in a written response, which will be circulated out to all participants, and here for your ease of reference. Most notably, syringes and needles should never be reused. A new sterile needle and syringe is required for each patient and each injection. In addition, it's important to understand what an auto-disable syringe is and what it can do. Auto-disable syringes are designed to have only one-time use. For this reason, they are really important tool in our toolbox to make sure that we have safe injection practices. There are different types of auto-disable syringes, and you can find a lot of information that may be useful on these using the links that are here on this PowerPoint slide. With that, I would like to go to our next slide, please. I'll give a brief overview of the agenda for today's call. We'll be hearing from Ali Reza about the regulatory presentation on lessons learned and updates related to COVID-19 vaccines. We'll then be hearing from John and Dorcas on key aspects of procurement. We'll follow this up with, as always, our What's Next, where we talk about how you can access the recordings and what the upcoming session topics will be. And then we will have plenty of time for you all to ask your questions and receive answers from our technical experts for today's session. Next slide, please. Today, we will be focusing on key information and updates for regulatory and procurement aspects of COVID-19 vaccine deployment. We have two learning objectives for today's session. The first is to explain the process for countries to prepare for market authorization or waivers for COVID-19 vaccines. The second is to provide an overview of the key aspects of procurement for COVID-19 vaccines and ancillary supplies. Next slide, please. I'd now like to turn to Ali Reza, who will give us our presentation on regulatory lessons learned and updates.
Thank you, Shoshana, and thanks everybody for attending this meeting. My name is Ali Reza Khadem, and from WHO, from Regulatory System Strengthening Team, and I'm pleased to provide a presentation about regulatory preparedness and the lessons learned that up to now. So with that, if I can have the next slide, please. So I'm sure that you already heard a lot about NDVP and this guidance and also the different chapters that we have in this guidance. Just for you to know, there are two chapters in NDVP guidance, Chapter 2 and Chapter 10, that are talking about related issues to regulatory activities. The Chapter 2 is related to regulatory preparedness, and Chapter 10 is about vaccine safety monitoring, which is also kind of regulatory activities, but related to the post-market phase. So next slide, please. The way that we see the regulatory preparedness and to provide timely access to COVID-19 vaccines, if we divide it into two phases as pre-market phase and post-market phase, we consider three major regulatory activities as pre-market phase, which was the regulatory approval of the vaccines, the COVID vaccines, the import permits that needs to be issued by the regulatory authorities and also other authorities that are engaged at country level, and also the lot release of these vaccines to the immunization program. And of course, as these vaccines are new and some of the information about these vaccines are incomplete, so the post-market phase is becoming very important to have a strong monitoring system to look at the safety, effectiveness, and quality of the vaccines that are in use. Based on that, if I can have the next slide, please. Based on that, there are certain important messages that we consider in Chapter 2 of this NDVP. Basically, we are advising and asking the countries to prepare different regulatory pathways for their public emergency, that these pathways will allow the authorities and the country to look at the vaccines and also evaluate them in the shortest possible time to provide access to this group of vaccines. We are asking the NRAs to develop emergency pathways using a risk-based approach to look at quality, safety, and efficacy of the products and allow them or take a regulatory decision about that. We are asking the countries to put these pathways in practice and basically to do simulation exercises before that they face the situation, to be sure that all these pathways are working properly during the emergency situation. We very much encourage the recognition and reliance on WHO decisions based on WHO pre-qualification or emergency use listing, as well as stringent regulatory authorities, especially for the countries that are not having proper regulatory capacity to take this type of decisions quickly and benefit from the other countries or WHO that can help them to take this type of decisions. Next slide, please. In the same, actually, on the same issue, we are also asking the countries to put the requirements in place to be able to issue the import permits for these products in minimum number of days possible. Regarding the testing of the vaccine, we see that there is a kind of tendency to test these vaccines. However, our position is very clear here. We are not advising these vaccines to be tested again at the country level because they are already tested before. And considering the complexity of the tests and also the reagents that may be needed for this type of regulatory activities, we are not advising the countries to test the vaccine. And this will help the system to, the regulatory system to approve the products faster. In addition, also, as I mentioned before, we advise the countries to strengthen their safety vigilance system to be able to control and monitor the vaccines that are used in their immunization program, if they are still safe, effective, and having the required quality. And of course, here we are trying to also establish in WHO specific roadmaps for each of these vaccines to be evaluated at WHO. And in this evaluation by our pre-qualification program, we take an initiative to involve many of the regulators in the world in this process. So they will be also involved in assessing of the vaccines, and this will help later on to accept the vaccines at country level. Next slide, please. In this regard, and during the development of the NDVP, we try to align this guidance with VIRAT, which is the vaccine introduction readiness assessment tool. And the questions that we have in VIRAT are completely aligned with the approach that I explained to you. You have the linkages to these various documents, so you can use this slide to go to the various documents. As explained by also Shoshana at the beginning, various training materials has been developed. There is a training material about Chapter 2 that, again, the link is here, and this is accessible to all of you. And also, in addition to that, as I explained, we are advising the countries to do a simulation exercise to know that what is their capacity to approve the vaccines in due time. And for that reason, we develop a tabletop simulation exercise that can be used by the countries. And this will help the countries to put all these pathways in practice and see if this is working at the country level. if we can move to the next slide, we, in addition to the simulation exercise that I mentioned recently, and this is what we developed in past few weeks, we also developed a new computerized simulation exercise, which is absolutely computerized, and there are various steps. You can see that there are 21 or 22 steps in this exercise that the participants can just go there and use this simulation exercise in addition to simulating all the steps of regulatory preparedness. This exercise is providing a lot of additional information to the participants. It is all the background information, references, guidelines, etc. So it is not only a simulation exercise, but also kind of training that is providing all the required information to the participants. It is very user-friendly and can be used by anybody who is involved in regulatory activities and giving a lot of information at the same time. At the end of this training, it is also, I mean, this simulation exercise, you will receive a certificate if of course you pass all the steps and respond correctly to most of the questions. Next slide, please. So here you will see the process for approving of the vaccines as it has been explained in COVAX. So after the WHO is issuing the emergency use listing for such vaccines, and this is basically also built upon the decision by stringent regulatory authorities. WHO will sign a confidentiality disclosure agreement with the countries, and based on this agreement, the countries will have access to the information and also the manufacturer's documentation, the dossier that the manufacturers are submitting to WHO for the evaluation and emergency use listing, and of course to the assessment report that is provided by our pre-qualification team in WHO. Based on this information, we are expecting that the approval will be a decision about approving or not approving of these products will be done by the regulatory authorities, and of course this includes the import permits and also lot release of these products. Here I have to mention that some of the countries may not go through this whole process of evaluating the products, and they may recognize and rely fully on WHO or SRA procedures, and they basically approve the vaccine in a very short time by providing import permits only. Next slide, please. So here I have few slides to explain to you that what is the status now in terms of approved vaccines worldwide. So what you see in this slide is basically the approved vaccines, and here I'm talking about AstraZeneca vaccines produced by Serum Institute of India or SK Bio in South Korea, which are the two targeted vaccines as part of the COVAX agreement that will go to many of the countries, and already this has been started and vaccines has been shipped to several countries already. So as you can see here, what you see in the green bars, there are about 101 countries that they approve the vaccine within 15 days after the evaluation by WHO and announcement of these vaccines that has been added into WHO emergency use listing, which is a quite good number. And you can also see that from 145 targeted countries here, there are still several countries that are either in process or not issued these approvals, that we are expecting that this gap will be also narrowed down in coming days. The data that I'm showing to you is from last Friday, 5th of March, but the situation is changing every day and every hour actually. Next slide, please. Yeah, here also you can see the situation about the regulatory approvals for 3 vaccines, for Pfizer vaccine, for AstraZeneca Serum Institute, and also for AstraZeneca SK Bio. So as you can see, these vaccines has been approved already in many countries, and we are following up with the countries that are still either in progress for evaluating the vaccine, or the process has not been yet completed. So this is also showing the situation from 8th of March, and we are following on daily basis and weekly basis with these countries to see that all the targeted countries will approve the vaccines, most of them. And then also there are some overlaps between the countries, because some countries they already approve one or several vaccines in their country. So what you see in the green zones, this might be a kind of repetition about, a country which is approving several vaccines at the same time. Next slide, please. WHO was following up for several years with 48 countries that are called PIP priority countries. And PIP is basically here pandemic influenza preparedness. And this was an effort that WHO tried to prepare these 48 countries to be able to quickly respond to any influenza pandemic by approving the vaccines in a very short time, pandemic vaccines in a short time. As you can see, also situation here is much more promising. So out of 48 targeted countries, already 45 countries are actually they approve the vaccine, and one or several of the COVID-19 vaccines, and the 3 remaining countries are pending, and basically some of the issues that we are facing in these 3 countries are not related to their regulatory decisions. This is beyond the regulatory decisions that we are facing in this country. So as you can see, this is showing that the impact of WHO efforts in regulatory preparedness in the previous years, and showing that this basically this efforts has an impact at the country level, and we see more countries with quick approval of the vaccines, and especially COVID vaccines here. So these are some of the facts and figures that I wanted to share with you. In next slide, which is basically my last slide, I also would like to emphasize a little bit about the challenges and regulatory challenges that we face in these countries, and also we learn from it during this emergency situation that we are facing. So one of the major challenges that I can mention about is the manufacturer's ability to submit the vaccine files, vaccine dossiers to multiple NRAs. So as you know, that the regulatory authorities are always asking for certain, I would say, set of information that should be submitted to them. And based on that group of information and evidences, they are taking the regulatory decision either to authorize a product or not to authorize the product. So this is a very common, I would say, activity by the national regulatory authorities. So as here we are facing a very special situation. The manufacturers should deal with a lot of regulatory authorities all around the world, and this might not be possible for them, and they might not have that capacity to send this information at very short time and at the same time to all the regulatory authorities. So to address that issue, WHO is basically entering into a discussion with these manufacturers to provide this information to the NRAs by signing confidentiality agreement between the NRAs and also WHO. So in this case, we try to solve this problem as much as possible, although there are still some requirements that there should be a submission by the manufacturer or by the official representative of the manufacturer to the NRAs. However, we see that the countries are becoming very flexible, and they are using regulatory agility in terms of their requirements, considering the situation that we are facing. The other challenge that we are facing is the additional the request for additional information and question or documents to from the NRAs to the manufacturers, that this is also creating a little bit of problem for the time being, considering that many NRAs are asking questions or are asking this additional information to the manufacturers directly, and perhaps the manufacturers are not having also that level of capacity to respond to all of them. So we tried also in that manner, we tried to play as an interface between the NRAs and also to the manufacturers, and we are receiving also a lot of requests as such, which we try to respond to the national regulatory authorities by providing this information to them. The other challenge that we face also, not everywhere, but some countries, they are asking for testing of the vaccine, and in this regard, they were asking about not only the vaccines to be tested in their country, but also for reagents and also for methodologies or procedures that how these vaccines should be tested, and this also created a little bit of problem, considering that we are not advising the NRAs to, or NCLs, National Control Laboratories, to test the vaccine, and basically based on some of the negotiations that we have with some of these countries, we finally have been able to convince them not to ask for the testing of this vaccine at this time, and as I mentioned, these vaccines are already tested by their competent national regulatory authorities, and of course at the level of the manufacturer, and there is no need for further testing. But this type of requests are coming to WHO to facilitate for testing of the vaccine. We also there are also requests from different partners for timely decision and approval of the vaccines by WHO, and also at the level of countries. So this is also another, I would say, challenge that we are facing, and also countries are facing, basically because of this type of request that is going to them for timely decision about the approvals. Sometimes the countries or NRAs become confused with so many requests that they are receiving, and this may delay a little bit the process for approval of such vaccines. Of course, here I'm just mentioning about the major challenges that we so far identified, but in total, I would say that we are very pleased with the speed of approvals of these vaccines at country levels, and with remaining, let's say, countries that either they are in progress or they are not approving the vaccines yet. There is a kind of prioritization about those countries, and we are dealing with these countries based on that prioritization, and we are trying to help them in their decision, in their regulatory decision about such vaccines. So with that, I would stop here, and I would be pleased to respond to your questions, if any, later on. Thank you, Sushana. Back to you.
Wonderful. Thank you so much, Alireza. We will now transition to our procurement panel. Next slide, please. So on this panel, we are going to start with John Fitzsimmons and then transition to having Dorcas as well provide responses on some of the key questions we've heard related to COVID-19 vaccine procurement. Next slide, please. So starting with John and then turning to Dorcas, the first question is, how is procurement for COVID-19 vaccines and ancillary supplies different from procurement for other products?
Thank you, Shoshana. Good day, everyone. My name is John Fitzsimmons. I'm the chief for the revolving fund for procurement here at PAHO/WHO for the region of the Americas. It's a pleasure to be with you here today. Thanks for this question. From our perspective at PAHO, given our experience with influenza and also the H1N1 pandemic going back to 2009 and 2010, you may recall that many of our countries in the regions were the last to receive vaccine. So this time around with the COVID situation, the birth of the ACT Accelerator, the birth of the COVID mechanism has helped to position countries to receive vaccine earlier, the new vaccine earlier. Of course, there are many challenges around that, some of which we were just listening to from a regulatory perspective. And so we're pushing forward in an attempt to provide better equity for countries in terms of access to vaccine at an earlier point in time to benefit from these new tools that are coming into the marketplace. We're working very closely with UNICEF Supply Division in this initiative. That cannot be understated at all. There's ongoing dialogue every day with Dorcas and with Anne and others, the team at UNICEF. And everything starts with the WHO allocation process. And that information on the availability of doses and allocation to countries goes into the COVAX facility and then comes back out to the two procurement agencies in terms of moving doses. And that's different from the way we currently operate here at PAHO. And so we're interacting with a global facility as opposed to just interacting with our countries or with our technical advisors on allocation of doses. So a whole system of information and coordination is required to make that happen. And then there's just to comment a little bit on the market itself. It's a supplier-driven market, right? Both for vaccines and syringes. So active engagement with these suppliers is very important. Collaboration with them and working with them to troubleshoot issues as they come up is very important. We have to remain agile and engaged with the suppliers. Over to you, Shoshana.
Wonderful. Thank you so much for that really helpful response, John. I'll now turn to Dorcas to speak from the UNICEF Supply Division perspective.
Thank you very much. And I think not really very much to add to what John has said, because indeed we are working very closely together. So to the extent that faces the countries, we are indeed doing very similar processes. So maybe it's, yeah, I don't want to repeat things that have been said, but we'll be happy to hear from anybody who has questions on that.
Wonderful. Thanks, Dorcas. So I'll turn to you first for our second question, which is, what are the key bottlenecks for COVID-19 vaccine and ancillary supplies procurement?
I think what we have seen, and this is really also what we are hearing from countries, is really access. There is a very, very constrained supply. John has spoken to this being a supplier market. Indeed, supply is very, very constrained. We are having to use the Joint Allocation Task Force algorithm that John has spoken to make sure that there is an equitable distribution of the vaccines that are being made available, the limited quantities that are being made available. I think another bottleneck really for the procurement is around the speed with which, while there has been a lot of interest in the joint tender that John mentioned too, from manufacturers that have expressed interest and willingness to deliver doses through the COVAX facility in 2021, one of the key bottlenecks for the procurement process is that a lot of that availability is very late in the year, which is very difficult to explain to countries or that are interested in getting access to these doses exactly when that they would get access to these doses, even when we speak about late in the year. One of the other things that was a key objective in the procurement process was to make sure that we had a balanced portfolio, to make sure that the awards or the vaccines that we are able to get access to reflect diversity in the portfolio. Of course, that has been a bit slower coming, being implemented because of the availability of the different vaccines through the procurement process. But I'll ask John to add to that. John, over to you.
Thanks, Dorcas. You hit on a number of important topics. Early on in this first quarter for 2021, we're dealing with a limited availability of supply. This is critical to understand. And we're in the process of getting those first procurement orders out and actual deliveries to countries. I believe just over the last week or two that this has been occurring. In the Americas, the first vaccines for Pfizer were received in Colombia last week. And this week, there should be a few shipments of the AstraZeneca vaccine. So together with UNICEF, we're pressing forward in getting out this limited supply as quickly as possible in relation to, particularly with AstraZeneca, being a new supplier to the market and dealing with some of those organizational challenges in standing up our facility and that supplier standing up its responsiveness to this global facility. So all those have been ongoing challenges for both UNICEF and PAHO and the suppliers. The other is that we currently have 3 LTAs, right? AstraZeneca, Pfizer, Serum Institute, but there are others on the way that need to be evaluated. We need to find time to do that and evaluate those offers. And we've got to prioritize that. So that's going to be some key upcoming work for us together. The country readiness component that you all have been working on over the past few months is critical. Be sure you're ready to receive vaccine. The indemnity, liability challenges, the export licensing challenges, all this will help at the end of the day in receiving your vaccine allocation. Here at PAHO, one of our other key challenges has been just getting out the price estimates to countries, getting their confirmations for the vaccine orders and purchase orders themselves, and then turning around and organizing with Dorcas and the UNICEF team the shipping of vaccines across the globe. So thank you for your collaboration on the readiness side, and we'll continue to push from our side to troubleshoot some of these bottlenecks. Over.
Wonderful. Thank you so much, Dorcas and John, for that really helpful response to the second question. I'll now turn to the third question for our panelists, which is, what can countries do to streamline this procurement process using existing procurement channels? Let's start with Dorcas, and then we'll turn to John.
I think if one of the things that countries could do to streamline processes is to really take this opportunity to consider just some opportunities to can I call it be able to react quicker. So John has spoken to the getting out the price estimates. In UNICEF language, we call them cost estimates. I think one of the things that could really help during this process is we know that supply is constrained, But if in the process of approving cost estimates, you know, there could be an understanding of, or some flexibility, then you will actually be shipped to, so that we have that flexibility that the approval has been received, and then after that we are just dealing with trying to get out purchase orders to you as quickly as possible. I think traditionally in the past, in some countries or in some cases, we've had to match the cost estimate with what they actually will get. But what we're trying to say here is there may be some need to have some more flexibility around that, to have the approval for a little bit more quantities than will go on each purchase order one by one, on understanding that eventually you will get all the quantities. But I think there needs to be some flexibility now to get the funding with the procurement agency, so that there is a quicker turnaround when doses are available for the procurement agency to convert that into purchase orders. I think the other thing that within the existing processes that are in place would be to just look at some of the paperwork requirements that are required for the acceptance of the cost estimate or for the purchase orders. I think there are some countries that have very, very many paperwork requirements. And what we find is in the pandemic period, it's quite difficult for the manufacturer who's trying to push out very many purchase orders to also have the requirement to provide so many of these additional documentation that we fully understand countries require. But it's just that in a pandemic time, trying to ship as many doses to as many countries as possible, having the requirement to also do many other extra papers is, could slow down things a bit. The other one that's really also touching on that, and it will be the last before I pass over to John, is around the country green light processes or pre-alerts. And again, here we are urging countries to reduce that green light timeline or pre-alert timeline, and asking countries to have the flexibility to receive the vaccines at relatively short notice. The reason for doing this is to make sure that doses are shipped out as quickly as they are available, and not waiting for the traditional 10, 15, whatever days of pre-alert or green light timelines that countries are accustomed to in our normal processes for shipping of the vaccines. John, maybe you want to add something?
Yes, thanks, Turkis. To reinforce a few of your points there, a key piece to this streamlining process from our perspective would be, one, look at the information you're receiving, particularly on the cost estimate or price estimate, as we call it here at PAHO, to be sure you know what you're receiving. The information is more extensive than you've been receiving for routine programs, for instance, whether it's BOPV, rotavirus vaccine, etc. So look through that information. If you have a question, ask the question and ask it quickly. We had, or in a timely way. We had a question over the weekend from an AMC eligible country, and I'm just using this as an example. Please confirm that the COVAX facility is actually covering the funding for this vaccine before I sign. So it's a good question. We responded to that question over the weekend, and we received confirmation from that particular country yesterday, and we can move to process that order. So if you have a question, please ask it on the documentation that's being provided. That's very important. Don't forget about your routine program either. We're putting so much emphasis on COVID that we need to be concerned as well regarding the routine, the inventory, the stocks there, the purchase orders that may be pending there, the financial support for both the COVID vaccine and for the routine program. So let's troubleshoot any financing issues that we may have together. This will help to streamline and expedite our processes. And then finally, I just comment on syringes. Without the syringe, we're unable to vaccinate, right? So review your current inventory levels of syringes. The market for syringes is very tight. We're also working closely with Dorcas's colleagues on that front. Both agencies are fishing from the same pond, i.e. we're dealing with the same suppliers for syringes. We're competing against other markets for those syringes as well. So having a good understanding of what's in stock on the routine while you wait for your COVID-related syringes to arrive, I think would be a good consideration. Back to you, Shoshana, and thank you.
Wonderful. Thank you so much for this fantastic panel, Dorcas and John. We'll now move forward with our What's Next portion of this session, followed by our Q&A. Next slide, please. As always, recordings from this session will be available in English, French, and Spanish. And as a reminder for all the folks who may have joined later in the session, there is interpretation available at the bottom of your screen using that globe icon. You can also continue the conversation from this session by asking your questions and sharing your experiences on TechNet and Telegram. The links to those different forums will be provided in the chat. I'd like to point to the upcoming sessions. Our next call on Tuesday is focused for health workers and will really center on understanding COVID-19 vaccines. Are they safe and effective? Which they are, but we know that we've received a number of questions from you all on this and wanted to make sure that we're providing you all the information you need about these COVID-19 vaccines. On 23rd March, we'll have our session for national and subnational focal points again, focused on generating acceptance and demand and building community support for COVID-19 vaccination. On the 30th March, Tuesday session for health workers will focus on reporting COVID-19 vaccines, both monitoring and adverse events following immunization. What are the processes, systems, and structures and lessons learned? On 6th April, for our national and subnational audience, we'll be talking about vaccination strategies for COVID-19. I know we already had some questions in the Q&A about this, so folks who are interested in that, please stay tuned and register for those upcoming questions. We now have about 12 minutes left for our questions and answers for all of our technical experts. So we'll go ahead and start channeling those over to our technical experts. Please continue to post your questions in the Q&A feature of the Zoom. So with this, I'd like to start with our first question, which is in response to John's earlier point about prioritizing evaluation. This question is from Kathleen, and it is, how do we strengthen cross-collaboration, multinational collaboration during this period of COVID-19 vaccination, knowing that this is complex, knowing that manufacturers also need to be working with a number of different countries. So over to you, John, on how we can encourage and really benefit from this unique position that we find ourselves in for COVID.
Yeah, no, excellent question, Catherine. Here at PAHO, we're finding that we're finding ways to work more effectively into programmatically. You know, this is an all hands on deck approach by PAHO, and I'm sure the other WHO regions as well. There's a lot at stake and for everyone in standing up the facility and also getting vaccine to the health workers for immunization. And we've been relying on some of our past experience, but also new experience, cross-border activities through Vaccination Week is an excellent example. Southern hemispheral influenza is being rolled out at the same time, and that's always been a big activity for us in the region during the month of April with Global Vaccination Week and Regional Vaccination Week. So what are the new opportunities through that and through the launch of COVID, right, to strengthen health systems in general for our countries and others around the world. We're also, with the support of IMST, surging to support one another. And that means realignment of staff at country offices, at regional offices, and globally. So don't be afraid to ask for help. Look for opportunities to collaborate, revisiting old ones, exploring new ones. I'm sure we can leverage our technology even more, digitization, reviewing of trackers and reporting of information. So there are many opportunities to continue to strengthen cross collaboration and develop it further. Over.
Wonderful, thanks, John. We now have a question about syringes. So as you and Dorcas mentioned, there's a strong need for syringes. We've got a question from one of our participants, Andrews, who's asking, what about all of the excess syringes? So first, how do they procure sufficient syringes? But then what happens when there are, at the end of the COVID-19 vaccination period, an excess of syringes? What will happen with those? So over to John and Dorcas for their response.
I'll start and then pass to Dorcas. So in our view, syringes have a long shelf life to them. That's one. And there are many needs existing in routine programs. So at this point in time, we're more interested in getting the additional syringes that we required in place per the vaccine supplier specification. So trying to align to that 80 syringe, which is most appropriate for the vaccine selection. Pfizer has a preferred syringe, with the dead space syringe. AstraZeneca has an AD syringe, 23G by 1, etc. So we're working through that together with our countries and with the suppliers. And following the pandemic, once we emerge from the pandemic, any remaining syringes out there can be redeployed in the routine program. Over.
Wonderful. Dorcas, do you want to
I don't really have much to add because I think John has covered it well. Thank you.
Okay, wonderful. I would like to note for our regulatory presentation that there was that link to the simulation exercise, and Ali and team will be sharing out those links in a way that they are accessible. We noted that some participants had to log in or register to use that simulation exercise. So instructions on how to access those will be shared after this call. We now have about 7 minutes left for this call. What I would like to do is ask all of our technical experts to share 1 or 2 words of wisdom. So if they can go ahead, turn on their cameras and provide some last guidance for the countries that are joining us on this call today. We'll start with Ali, we'll then go to Dorcas, followed by John.
Yeah, thank you very much, Shoshana. Regarding the link to the simulation exercise, this is on a secure SharePoint. So if you want to get access, just click on the link and then send a short message to us. We will reply to that. One message that I want to provide here is that regarding the regulatory activities, we are dealing with a very special case now. We are having a pandemic and there is a need for these vaccines all around the world. If the regulatory authorities would like to follow the same procedures that are following in the normal conditions, this may take a long time to get access. That is why we are advising for flexibility. We are advising on reliance. We are, as WHO, we are taking a very important role to ensure the quality of these products. That is why if all the countries want to follow up their normal procedures, they may delay the access to these vaccines. If the countries want to test the vaccine, for example, here, because there were several questions about that, this may delay, and this might not be even possible for them at this point to test the vaccine in a short time. It's usually a very complex process. So everything is about basically a risk approach, looking at the risks and also looking at the benefits and what is the best decision to make for the time being. So this is my basically the most important message for this meeting. Over.
Wonderful. Thank you so much, Ali. Over to Dorcas, if you could kindly turn on your video and share your words of wisdom. I see Dorcas may have had some connection issues, so I'll turn to John. John, can you go ahead and provide?
No, thanks, Shoshana. Yeah, I would use the 3 Ps: patience, perseverance, persistence. Patience, there's a lot going on. We all have competing demands. We all need to continue to collaborate effectively with one another. Continue to be patient with one another. Perseverance, we can't give up. There's a lot of tension, political, technical, supply chain related. We have to hang in there despite these tensions. And then persistence, we have to follow up. We have to stay engaged. So I would share the 3 Ps. We try to practice that here at PAHO. Sometimes we have good days. Sometimes we don't have such good days, but we're pushing. We're pushing for you. We're pushing for one another. Thank you for this opportunity. Over.
Wonderful. Thank you so much to our fantastic presenters, Ali, John, and Dorcas. We will be sharing the recordings from this session shortly. We'll also be sharing out the presentation in a PDF format so that you can access it at your leisure. Any unanswered questions related to the topic will be shared with our technical experts, and those responses will be provided out to you shortly. With that, I would like to say thank you so much to our fantastic presenters, to the ECHO team for helping us to develop this session, for our wonderful interpreters, and most of all, to you, to all of our participants in today's session. With that, we'll go ahead and close this call, giving you all 3 minutes back in your day.